What's up, Microbiology Nerd Squad? Welcome to episode 5. Today, we're taking a fascinating dive into the upper respiratory tract to explore the world of upper respiratory tract infections. We'll break down what they are, what causes them, their symptoms, how our body defends itself against them, and of course, I'll walk you through the ways we diagnose and treat them in the lab. Ready? Let's get started. The upper respiratory tract consists of the nose and nasal cavity, where the air enters and is filtered, warmed, and humidified. The sinuses, hollow spaces that produce mucus. The pharynx, also known as the throat, a muscular tube that connects the nasal cavity and mouth to the larynx and esophagus. And larynx, also known as the voice box. This houses the vocal cords, produces sound, and protects the airway during swallowing. So what exactly are upper respiratory tract infections? URTIs are infections that impact any part of the upper respiratory system. Let's take a look at the list of infections and the specific parts of the body they affect. Common cold, also known as viral rhinitis. It affects the nose and nasal passages. Sinusitis, this affects the sinuses. Pharyngitis, also known as sore throat. Laryngitis, which affects the larynx, also known as the voice box. Tonsillitis, which affects the tonsils located at the back of the throat. Epiglottitis, epiglottis, the flap of tissue that covers the windpipe during swallowing. Rhinitis, this affects the nasal passages, especially the mucous membranes of the nose. Tracheitis, this affects the windpipe, also known as the trachea. Whooping cough, this primarily affects the trachea and bronchi, but can extend to the lungs. Otitis media, it affects the middle ear, the area behind the eardrum. Remember the tip from episode 4 about the suffix itis, meaning inflammation? This knowledge can help you decode terms like laryngitis, which means inflammation of the larynx. How do you know when you're suffering from an upper respiratory tract infection? These infections often present with symptoms such as a runny or stuffy nose, sore throat, difficulty swallowing, cough, sneezing, headaches, ear pain, swollen lymph nodes, loss of voice, body aches, and sometimes a fever. These infections are notorious for spreading like wildfire, especially during the colder months. Did you know upper respiratory tract infections are one of the top reasons people visit their doctors? They account for millions of lost school and work days each year. Quick comparison time. Remember our deep dive into lower respiratory tract infections in episode 4? While upper respiratory tract infections affect the upper parts of the respiratory system, lower respiratory tract infections hit the lower parts. Lower respiratory tract infections, like pneumonia and bronchitis, often result in more severe symptoms such as chest pain and difficulty breathing, while upper respiratory tract infections cause symptoms more related to nasal congestion and throat irritation. If you missed that episode, be sure to check it out to see how these two types of infections compare. Have you ever wondered why you tend to get sick more often in the winter? The cold weather doesn't directly cause colds, but it does make our nasal passages drier and our immune systems a bit weaker, giving viruses an easier time to invade. So what causes these infections? Upper respiratory tract infections are usually caused by viruses, though bacteria are also known to cause trouble. These pathogens spread through inhalation of airborne droplets, direct contact with contaminated surfaces, or close personal contact. Ever been on a packed train during flu season? Yeah, that's a perfect environment for upper respiratory tract infections. Let's take a look at the culprits that cause URTIs, shall we? Common cold, primarily caused by rhinoviruses, but other viruses such as coronaviruses, adenoviruses, and respiratory syncytial virus can also be responsible. Sinusitis can be caused by viruses, similar to the common cold, bacteria, such as Strep pneumoniae and Haemophilus influenza, or fungi, although rare, often found in immunocompromised individuals. Pharyngitis, commonly caused by viruses, such as the influenza virus or adenoviruses, and bacteria, particularly Streptococcus pyogenes, which is a group A Streptococcus, which leads to strep throat. Laryngitis, most often caused by viral infections, for example rhinovirus or influenza virus, but can also be due to bacterial infections, overuse of the voice, or irritants like smoke. Tonsillitis. This is caused by both viruses such as EBV and bacteria, most commonly Streptococcus pyogenes. Epiglottitis. This is primarily caused by bacterial infections, particularly Haemophilus influenza type B, though it can also be caused by other bacteria like Streptococcus pneumoniae. Rhinitis. This can be caused by allergens, viruses, irritants, or certain medications. Tracheitis. Often caused by bacterial infections, particularly Staphylococcus aureus, but can also follow a viral respiratory infection. Whooping cough. This is caused by the bacterium Bordetella pertussis. Otitis media, commonly caused by bacterial pathogens such as Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis. Viruses can also play a role by causing inflammation that leads to a secondary bacterial infection. Fun fact, rhinoviruses, the main cause of the common cold, have over 100 different serotypes. That's one reason why you can catch a cold multiple times and why creating a vaccine has been so challenging. So how does our body defend itself against such infections? Well, our respiratory tract has several defense mechanisms to prevent infections. It contains immune cells like macrophages and lymphocytes that identify and destroy pathogens. The upper respiratory tract is lined with ciliated epithelial cells that move mucus towards the throat to be swallowed or expelled. Mucus traps dust, microbes, and particles. Within the mucus, secretory antigen IgA neutralizes pathogens before they can infect us, and our nasal hairs filter large particles from inhaled air. We also have normal flora in the upper respiratory tract that outcompetes potential pathogens, reducing infection risk. Fun fact, did you know that the cilia in your nose and throat beat at the rate of about roughly 700 times per minute? These tiny hairs are working overtime to keep your respiratory tract clear of harmful particles. Isn't that cool? Lab diagnosis. Diagnosing upper respiratory tract infections starts with sample collection. These include throat swabs, nasal swabs, endotracheal tube aspirates, aspirates from the ear, and nasopharyngeal aspirates. Each type of sample helps us zero in on the pathogen causing the infection. We might use rapid antigen tests for bacterial infections like strep throat. This test quickly identifies the presence of Streptococcus pyogenes. Currently, mass spectrometry is used for early identification of bacteria and fungi. Matrix-assisted laser deabsorption ionization time-of-flight mass spectrometry, also known as MALDI-TOF MS, is rapid and sensitive, which makes it a popular choice of microbial identification. It only takes a couple of minutes to identify microorganisms to species level. For viral infections, polymerase chain reaction, PCR, is often used to detect genetic material. Respiratory samples may also be cultured on various media to grow and identify bacteria or fungi. For example, throat swabs and nasal swabs are cultured onto blood agar to identify pathogens like Streptococcus pyogenes and Moraxella catarrhalis. Enriched media, such as chocolate agar, is used for specific pathogens like Haemophilus influenzae. Chromogenic agar can also be used to culture bacteria such as Bordetella pertussis. Fungal cultures use sabroid agar when a fungal infection is suspected. The inoculated plates are incubated at different temperatures and conditions. Plates are read at 24 to 48 hours, and susceptibility testing is performed on significant isolates. Did you know that PCR, which is used to detect viral genetic material, was instrumental in identifying COVID-19 early in the pandemic? It's one of the most powerful tools in modern microbiology. Treatment. Clinicians follow evidence-based guidelines to treat upper respiratory tract infections. Initial assessment involves a consultation followed by a physical examination to check for signs of a respiratory tract infection. Since most are caused by viruses, treatment focuses on symptom relief, rest, hydration, pain relief, decongestants, and antihistamines. Home remedies like salt water gargles, honey for coughs, and steam inhalation for nasal congestion are also recommended. For bacterial infections like strep throat, antibiotics like penicillin or amoxicillin are commonly used. Alternatives like azithromycin can be used for those allergic to penicillin. Moraxella catarrhalis infections, such as sinusitis, are treated with antibiotics like augmentin or azithromycin due to its beta-lactamase production. As mentioned earlier, fungal infections aren't as common, but if they do occur, specific antifungal drugs like fluconazole or itraconazole are used to treat fungal infections in the upper respiratory tract. Fun fact: overuse of antibiotics can lead to resistance, which is why it's crucial to only use them when absolutely necessary. This is why most upper respiratory tract infections, being viral, are not treated with antibiotics. Prevention: vaccinations, good hygiene, and a healthy lifestyle are key to preventing upper respiratory tract infections. Did you know that one of the most effective ways to prevent the spread of upper respiratory tract infections is simply washing your hands? Think about how many surfaces you touch daily and how easily germs can spread from person to person. So there you have it, folks, a detailed look at upper respiratory tract infections. Please make sure to hit that like button, subscribe, and comment if you have any questions. Stay curious, and I will see you in the next one.